If you've seen a tinnitus specialist or spent a few nights at 2 a.m. searching on tinnitus forums online, you've probably seen or heard the word habituation. The ringing may not go away, but you can habituate to it. And for a lot of people, that's where the explanation ends, which is a problem. Because when a patient hears that, what they often hear is, we can't make it stop, you're going to have to learn to live with it. And I'll be honest, I hate that phrase. Not because the tinnitus always disappears, it often doesn't. But learn to live with it gives you the burden without giving you a roadmap. Real habituation is not resignation, it's not coping, and it's not white-knuckling your way through the rest of your life. It's a genuine neurological change. Your brain and nervous system learning over time that the tinnitus is not a threat. And once that happens, the tinnitus can stop running the room. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus in Utah. I hold the certificate in tinnitus management from the American Board of Audiology, and I've been treating tinnitus patients for over 20 years. Today, I want to give you the explanation that you didn't get before.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
Let's start with what habituation is not, because that's where the confusion really begins. Habituation is not silence. When someone fully habituates to their tinnitus, the sound doesn't magically disappear. If they sit in a quiet room and listen for it, it's still there. The pitch, the loudness are often unchanged from the first day they had tinnitus. It's also not coping. Coping means you still notice it constantly, it still bothers you, and you're grinding through the day. That's not what we're aiming for, and it's definitely not resignation. Telling someone to learn to live with it is not treatment. It's an instruction with no mechanism. I've never found it particularly helpful when a patient tells me their doctor said that because it gives the patient nothing to work with. I'll also say this. I wish we had a better word than habituation. It sounds cold. It sounds like something you do when nobody has anything better to offer. But the concept is actually hopeful. The word just doesn't do it justice. What habituation actually is a change in how your brain classifies the tinnitus. Not a change in the signal, a change in what your brain decides to do with it. Understand that, you need to understand how your auditory system connects to the rest of the brain. When your ears detect a sound, that signal doesn't just go straight to the auditory cortex in isolation. It routes through the limbic system, the emotional part of your brain, and also through the autonomic nervous system, your body's automatic threat response system. Think of it this way. The limbic system asks, should I care about this? And the autonomic nervous system asks, do I need to gear up for danger? Heart rate, breathing, stress hormones, that's the autonomic system responding. This is the neurophysiological model of tinnitus developed by Dr. Pavel Jastreboff in 1990, and it remains the foundational framework for understanding why tinnitus becomes bothersome for some people and not others. The auditory system detects the signal, but it's the limbic system and the autonomic nervous system that decide whether that signal matters. The smoke detector analogy makes this concrete. The sound of a smoke alarm isn't inherently dangerous, but your body's response to it as if something's terribly wrong, heart pounding, adrenaline, hypervigilance. Now imagine that smoke detector going off randomly with no fire every single day. Your body keeps responding. Sleep disrupts, concentration suffers, and you can't stop scanning for the threat. That's clinically significant tinnitus. The auditory signal triggers an automatic threat response. And here's the key. It's not the sound that's making your life hard, it's the meaning your brain has assigned to that sound. Habituation is the process of your brain reclassifying that signal from threat to neutral. Once that happens, your brain does what it does with all other neutral repetitive sounds. It stops prioritizing them. If you spent times in the tinnitus forums or left a clinic appointment with more questions than answers, subscribe to the channel. That's exactly who this channel is for, and I put out 2 videos every single week. In the clinical literature, habituation is described in 2 distinct stages, and understanding both clarifies a lot. The first is habituation of reaction. This is the limbic and autonomic nervous system pieces. The tinnitus is no longer triggering that stress response. You're aware of it, but it's not causing anxiety, dread, or any tension. This is the foundational stage, and it's the one that matters most for your quality of life. This is also why we measure treatment success first by distress, sleep, focus, and function, not by whether the tinnitus volume has changed. Because the volume often doesn't change. What changes is whether your nervous system retreats it as an emergency. Once the reaction is habituated, the second stage often follows naturally, habituation of perception. The brain, now that the signal has been classified as unimportant, begins to actively filter it out before it even reaches conscious awareness. People at this stage can go hours and sometimes days without noticing the tinnitus at all, even though it's still detectable if they stop and listen to it. Think about living next to train tracks. The first few weeks, every train wakes you up. A year later, you sleep right through it. The train is still running on the same schedule. Your brain just stopped treating it as something that needed to pay attention to. Not everyone reaches full habituation of perception, but habituation of reaction alone is enough to restore quality of life for almost everybody. That's the goal. Now, where does the evidence actually point? This is worth being clear about because there's a common misconception here. Habituation as a concept comes primarily from the tinnitus retraining therapy literature, the protocol that was built by Jastreboff. But the strongest research evidence for achieving habituation consistently points to cognitive behavioral therapy. A 2020 Cochrane review, that's the gold standard of evidence synthesis, analyzed 28 randomized control trials with nearly 2,800 participants. Cognitive behavioral therapy was found to reduce the negative impact of tinnitus on quality of life compared to no treatment. And when compared directly against tinnitus retraining therapy and audiological care, cognitive behavioral therapy probably outperforms them on quality of life outcomes. The same review confirmed few or no adverse effects. A separate meta-analysis of 15 randomized control trials found a moderate to large effect size for cognitive behavioral therapy on tinnitus distress. And a 2023 guidelines paper stated plainly that cognitive behavioral therapy is the best investigated treatment intervention for tinnitus. None of that means that tinnitus retraining therapy is without value. Jastreboff's neurophysiological model is the right map. It just means that cognitive behavioral therapy has the strongest evidence for making the journey. And sound therapy, hearing aids when hearing loss is present, and also new tools like linear bimodal neuromodulation all work on different parts of the same system. They're not competing with each other. They're addressing different mechanisms that all feed into whether the brain keeps treating your tinnitus as a threat. Patients who are habituating don't usually announce it dramatically. They say things that are a little bit more discreet than that. They say things like, I notice I have more good days lately, or I realized last Tuesday that I hadn't thought about my tinnitus in hours. It's still there, but it doesn't feel like I'm controlling my life. One patient told me, I still hear it, but I don't negotiate it with it all day anymore. That's one of the clearest descriptions of habituation of reaction I've heard in over 20 years. That shift from this is a crisis to this is just a sound is what the process looks like from the inside. It's gradual and it's not a single moment. And it's because it's incremental. People often don't recognize how far they've come until they look back. One honest thing about timeline. For some people, meaningful relief comes within a few months. For others, it could take 12 to 18 months. The people who tend to struggle longest are the ones constantly monitoring it, listening to see if it's louder, and researching it online for hours and tracking every fluctuation they see. That hyperfocus keeps the signal classified as threatening. It actively works against habituation. And it's one of the reasons cognitive behavioral therapy is so effective. It directly addresses that pattern of attention and catastrophizing. So what does this mean practically? The goal of treatment is not silence, it's reclassification, changing what your brain decides to do with the tinnitus. If someone is promising you silence, be skeptical. Different treatments work on different parts of the system. Sound therapy reduces the auditory contrast that makes tinnitus stand out, making it easier for your brain to deprioritize it. Cognitive behavioral therapy addresses the thought patterns and the attentional habits that maintain the threat response. Hearing aids, when hearing loss is present, reduce the auditory deprivation that's driving the brain's hyperactivity in the first place. And again, newer approaches like linear work on neuroplasticity through bimodal stimulation, a different mechanism pointed at the same outcome. These tools aren't alternatives, they're part of the whole treatment system, which means a proper evaluation matters. Before anyone can tell you which combination of these treatments makes sense, they need to understand your specific tinnitus, not just your hearing thresholds, but how the tinnitus behaves, what's driving your distress, and which mechanisms are most involved. You also want someone with real tinnitus training, not just hearing aid experience. Look for the CHTM credential from the American Board of Audiology. That's a certificate in tinnitus management. It means specific clinical training in tinnitus assessment and treatment. Habituation isn't learning to live with it. One is passive resignation. The other is measurable neurological change. Your brain has an amazing built-in capacity to reclassify sounds as neutral and stop responding. That's not a theory, it's how your nervous system works. The goal of every legitimate tinnitus treatment is to support that process. The smoke detector may still chirp, but your nervous system can stop responding like the house is on fire. For many people with bothersome tinnitus, especially with the right treatment approach, that outcome is genuinely achievable. Now, I want to hear from you. What language did your clinician use when they explained the goal of treatment? Habituation? Coping? Management? Or did they tell you to learn to live with it? I'm genuinely curious what you were told. If you want to go deeper on different tinnitus treatments and how they work and what each one is actually trying to change, I've put together a free learning center with detailed clinical guideline, no email gate, no pressure. Link can be found in the description. And if you're here in Northern Utah and want a proper tinnitus evaluation, you can schedule an appointment in one of our clinics along the Wasatch Front. I put a link to schedule in the description below as well.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.